Hello students, welcome. Myself Dr. Roshni, your OBGYN faculty in DigiNerve. So today I want to tell you about one patient which I saw recently, but very common clinical based scenario case question for you in your NEET exams. So she was around 25 years, one para one living one, came with complaints of spotting PV for last 1 week, and also she had pain abdomen on the left side which is increasing from last night. That is what she told me. But on elaboration she told me her LMP she had missed period for 1 week. After that she had this spotting PV which she thought to be as a 1 week delayed periods. Okay, that is what she thought. So what do you think this case was? Yes, she was a case of ectopic pregnancy, correct. So in ectopic pregnancy, the patient will have these triad of symptoms. One is what? Missed periods. Okay, whenever in a reproductive age group, whoever comes in the reproductive age group, be it sterilized, non-sterilized, always if they have missed periods or having complaints of abnormal uterine bleeding, you have to rule out pregnancy. So ruling out pregnancy is your first priority in a patient with a reproductive age group. Okay, so that time you always have to rule out pregnancy. So first symptom or a first in the triad, first thing is missed periods. As in this patient, it was 1 week delay, and then next symptom is spotting or bleeding PV. They may not have the profuse bleeding, but because of endometrial shedding now, they will have the spotting PV. Okay, spotting PV and bleeding PV. And lastly, the pain abdomen. Pain abdomen is one of the symptoms they have. These are the three symptoms which is most common in a case of a ectopic pregnancy. So here, how do you differentiate between ruptured ectopic and a non-ruptured ectopic? So in a ruptured ectopic, what do we have? We have other signs like what? For example, in a general physical examination, they may give you a history saying the patient had complaints of hypotension, syncopal attack, or also they can give you patients is tachycardic and having low BP. These are the complaints they also add in a general physical examination. Coming to abdominal examination, here they have symptoms like what? Deep or they have deep palpation tenderness or guarding rigidity, abdomen is distended, these things. Okay, but the classic feature, the important feature lies in your PV examination. When you do a bimanual examination, you can see fullness on the side wherever there is ectopic, be it right side ectopic, right sided fornicial fullness you can feel. Okay, when you do a PV, the fornicial fullness is there. Along with that, we have one classic symptom or sign, that is what? That is a cervical motion tenderness. Okay, in ectopic pregnancy, we always find cervical motion tenderness. When you do a bimanual examination, move the cervix, they will have severe pain. This symptom or sign is also seen in where? In which case? Yes, this is also seen in a case of PID. Okay, so in pelvic inflammatory disease and ectopic pregnancy, you have cervical motion tenderness. So these were the common questions. One is cervical motion tenderness, another is a clinical based scenario where a patient is missed periods by 1 week, and then you will have these all other symptoms add on. On an ultrasound, what is the classic sign or a symptom for ectopic pregnancy? What is the classic sign? It is with the Doppler, they have ring of fire appearance. Okay, ring of fire. Peripherally, fully all the side, there will be blood supply. So it is a ring of fire appearance on Doppler. These are the classic features of a ectopic pregnancy. Remember, ectopic pregnancy is the most commonly asked clinical based scenario question in a case of a obstetrics. Thank you.